I am going to be demonstrating an IV push for Dilaudid.
Oh, I gotta go.
The patient was ordered 1.5 milligrams. I did the math on how fast the push should be. The push should be 0.25 every 30 seconds. I am going to first assess pain and sedation level for the patient, as well as the blood pressure, which needs to be 100/60, and then the heart rate, which needs to be over 60, and his respirations, which need to be over 12. So once I have established that it is okay to give him the medication, I'm going to make sure I have alcohol swab, saline, syringe, and his medication. I am going to assess the IV site for redness and swelling, and I don't see any redness and swelling, so I am going to clean the port for 15 seconds with an alcohol swab. I am going to attach the saline syringe. I'm going to open his IV line. I'm going to pull back and aspirate to check for blood flow. Back, if he is has had fluid recently, like an IV drip, he may not have blood return. So then I'm going to push 2 to 3 milliliters slowly to make sure there's patency in his line and that the vein is still good. Once I do that, I can remove the saline and attach the Dilaudid. I am going to push 0.25 every 30 seconds. So I'm going to wait 30 seconds after the 0.25. I'm going to push it again. Wait 30 seconds. Push 0.25 over 30 seconds. 0.25 for another 30 seconds. I'm going to continue this all the way until the medication is gone. And I do want to make sure that I'm waiting the whole 30 seconds before I push each way. Now that I have finished with the Dilaudid syringe, I can continue it. I'm going to need to continue it for 2 more 30-second segments. The 0.25 because there is still Dilaudid in the line.
What if you get your citizenship?
And then once I do that and it's gone out of the line, I can flush another 3 to 4 milliliters of saline, and as I'm doing that, I would lock his IV line so that there's positive pressure in his line. I'm going to remove it. I'm going to make sure that I'm assessing his sedation level, let him know if he has any nausea or anything to hit the call light, and then I can leave the room. Once I have left the room, I would come back in 15 minutes and reassess the patient again for pain level, sedation level, and I would check his vitals.